Hello, my name is Martha De La Vega and I am one of the RN case managers at Family Healthcare. And today I will be showing you how to use a Naloxone or Narcan kit for opioid overdose. Inside of our kit, you will find 2 vials of Naloxone. You will also find a syringe and a needle inside. You will find some alcohol pads, a guide with our step-up processes, and a glove. In the event that you suspect an overdose, it may be a friend or family member, some symptoms you may find will be the person will be non-responsive, will be very difficult to arouse, may not be breathing or having some slow and shallow breaths. You may even suspect that their nails or their lips start to turn blue, even pinpoint eyes. At this point, the first step you would want to do is call 911. And many times in these situations, you will be very nervous, panicked, or even afraid. So just go ahead, you can set your phone down aside, place it on speakerphone, and the paramedics or the 911 operator will be able to guide you through all of these steps I'm about to go through. And just keep in mind that the medical professionals will be on their way to help you. At this point, inside your kit, you'll remember you have 2 vials of the Naloxone medication. You will start by opening up your package of the syringe and the needle. You will go ahead and attach and twist on the needle to the syringe. To open up the vials, you would just go ahead and pop off the orange covering, like so. I usually like to go ahead and put in about 1 milliliter of air. It makes drawing up the medication a lot easier. So you'll go ahead and pull back on the syringe up to 1. Go ahead and puncture through the rubber topping of the vial and go ahead and just push the air in. You will go ahead and flip the vial over, and just like a vacuum, the medication will actually just suck into the syringe, or you can pull back. You'll want to go ahead and make sure you get all of the medication you can. Should be about 1 milliliter, so about a 1 on the syringe. Once you have completed that, you can tap the syringe just to get any air bubbles out, and go ahead and push up until there's no more air inside. At this point, you will be ready to administer. The injection is an intramuscular injection, and our insert actually just breaks it up into 3 easy steps. To go ahead and insert the syringe and the needle into the vial, to draw up, and it even lays out the different muscular places that we can give the injection. The most common areas will be your deltoids or your thighs. If able to, or if you remember to, you can go ahead and also clean the area with an alcohol wipe, and you can place the glove on the hand that will be in direct contact with the patient's skin. You'll go ahead and you'll give the full milliliter into the muscle. It takes about 2 to 3 minutes for the patient to respond. If within those 2 to 3 minutes the patient's not responding, is when we'll go ahead and repeat the dose with the second vial. This kind of works like an epinephrine pin. The same way where we see a person go into anaphylactic reaction and we give epinephrine is the same thing as naloxone is to an opioid overdose. It is a temporary antidote, which again lasts about 30 minutes. After the second dose, many will respond and will either wake up in an agitated behavior or precipitated withdrawals. In the event that this happens, you may either just leave the person in case they do become combative, and at this point paramedics will probably be on scene and will help. If the patient has not woken up, again, paramedics will also come and most likely may administer more. The most important thing to remember is always to call 911. In these situations, you will become very panicked and nervous, so this is the #1 intervention to help your friend or loved one. If you're interested, you can pick up your free Naloxone kit at any of our 4 family healthcare clinical locations.